Illness of the heart. The most prevalent heart disease is coronary syndrome or coronary syndrome in its different forms, which can damage any of the heart's activities and any region of the heart. Coronary blood vessels are blood vessels that run along the outside of the heart muscle and are responsible for delivering blood to the heart. Heart information. The heart has 4 valves, each of which can be damaged or malfunction. The basic malfunctions of the cardiac valves are divided into 2 categories. 1. Stenosis of the heart valves. That is, the inability to pump blood and transport it between the various sections of the heart, necessitating higher blood pressure to attain the heart's normal pumping capacity. 2. Heart valve that is dilated. Even though the heart valve is designed to fully prevent blood flow continues. The conduction system in the heart is in charge of conveying electrical signals that stimulate cardiac contractions, regulate contraction time, and govern the relationship between ventricle and atria contractions. Rapid heart rate, sluggish heart rate, irregular heart rate, or the absence of any apparent time relationship between the timing of ventricular contractions and the timing of atria contractions can all be signs of a problem with the electrical transmission system. Heart valve illnesses can be congenital, in which case heart murmurs are predicted when listening to the heartbeat, or acquired as a result of numerous viral heart diseases that affect the heart valves directly or indirectly. The heart valves can be damaged as a result of the atherosclerosis process. When there is a suspicion of a certain form of heart illness, you should contact your family doctor or an internal medicine specialist, but, depending on the circumstances, it may also be required to consult a heart disease specialist, cardiologist. How the heart functions. It is easier to comprehend the reasons of heart illness if you know how the heart works. The heart is a muscular organ the size of a fist that is placed slightly to the left of the middle of the chest and functions as a pump. The right and left halves of the heart are separated. The purpose of this separation is to keep oxygen-rich blood from mixing with oxygen-depleted blood. The oxygen-free blood is blue in hue and circulates in the body before returning to the heart. The right atrium and right ventricle make up the right side of the heart, which receives blood from the lungs and pumps it to them via the pulmonary arteries. The oxygen-rich blood flows from the right side of the heart to the left side, which includes the left atrium and left ventricle, and from there, the blood is pushed to the body through the aorta to deliver oxygen and nutrients to the various tissues of the body. The appropriate flow of blood is ensured by the 4 valves in the heart. When the valves are depressed, they only open in one direction. Every single heartbeat, or roughly once every second at rest, each valve opens and shuts once. There is also a network of electrical wires in the heart that is important for keeping the beating going, with electrical impulses starting at the top in the right atrium and traveling down a unique path to the ventricles, conveying orders to remove blood. The transport system is responsible for ensuring that the heart beats at a continuous and healthy rate so that blood continues to circulate in a circulatory manner. The mechanism that keeps life going is the constant shift between oxygen-rich and oxygen-free blood. Inflammation of the heart muscle can occur as a result of contagious heart disease caused by viruses, immune system reactions, or alcohol and drug addiction. When does a person develop heart disease? When there is a process of hardening and deposition of a coating of calcium and fat inside the coronary blood vessels, or when constriction occurs in these blood vessels, it is possible that the hollow narrows, obstructing blood flow to the heart muscle. Any interaction with the heart muscle or its ability to contract can cause the heart's ability to contract to be reduced temporarily or permanently. When the heart's ability to contract is impaired, blood flow to essential organs in the body is reduced. This constriction of blood arteries causes angina pectoris. If irreversible damage to the heart muscle occurs, myocardial infarction ensues. A person suffering from angina pectoris or myocardial infarction may experience pain or pressure on the chest wall, which may be accompanied by sweating, a sense of suffocation, shortness of breath, nausea, and a general feeling of weakness. This is an emergency situation that necessitates immediate medical attention. Heart disease symptoms. The following are the symptoms of cardiac disease, which vary depending on the ailment. 1. Cardiovascular disease symptoms. Cardiovascular disease is caused by constriction, blockage, or hardening of blood vessels, resulting in insufficient blood flow to the heart, brain, and other body organs. The following are some of the signs and symptoms of cardiovascular disease. Chest discomfort. A feeling of being out of breath. Legs and arms numbness, weakness, or a cold sensation. 2. Arrhythmia-related heart disease symptoms. An arrhythmia is a type of irregular heartbeat in which the heart beats faster than usual, slower than normal, or irregularly. Heart disease symptoms linked to arrhythmias include a flutter in the chest, a fast heartbeat, a steady heartbeat, chest discomfort, excessive gasping for air, dizziness, fainting or a situation that is similar to it.